welcome back. I'm Julian, and this is Laura. Welcome, Laura, to the podcast.
Hi, thank you. Lovely to meet you. Thank you for having me today.
Absolutely. Thank you very much for coming on. All right, so let's get started. Can you walk us through your journey in nursing very broadly, just from starting as an A&E originally now to your current role?
Yeah, of course. So yeah, it's been a bit varied. So I've been qualified for over 18 years now, so quite a long time. So I originally, before I did my nurse training, I worked in A&E. My title was Emergency Department Assistant. So I'm not sure that role exists anymore, but it meant that I had various kind of duties. So I was allowed to take blood, cannulate. I was allowed to plaster fractures. I was trained in using a defib. So I did that for a couple of years, and it was absolutely learned so much in that 2-year period. So then luckily they seconded me to do my training, so they paid me really to do my training, which was great. And then from qualifying, I went straight into giving chemotherapy, so working with cancer patients in a day unit. So I did that for about 5 years. So I worked my way up and became a chemotherapy sister. I then decided to take the leap of faith and leave the NHS and went to work in the private world. So I worked for a private travel clinic company called Nomad. They are still going now, been going for over 30 years now. So I set up a few travel clinics. Obviously, my main role was partaking in travel consultations, administering vaccinations, anti-malarial medication, that kind of thing. So I did that for about 4 years, then decided to go back into the NHS and worked as a school immunisation nurse. So I did that for 7 years. And then left the NHS again, went back into the private world. And that's when I kind of moved into the area of working in training. So my title was clinical development manager. So I developed lots of training, delivered training, and we mainly focused on pharmacists, where we train them in giving flu vaccines, any sort of vaccination training, basic life support training. So I was there about 18 months, worked my way up to become a director, and thought, don't know if this is how I want my career to pan out. So I am now self-employed, mainly delivering training. So I'm doing lots of immunisation training. We've just finished doing some flu training. I do lots of travel health training. I am still vaccinating as well, so I'm on the bank still going into schools to do school immunisations as well. I do have my own company as well. It's a company that I created to support pharmacists setting up their own travel clinics as well. So yeah, quite varied. I would say quite varied. Mainly immunisations though. That really is the most part of my nursing career is working in immunisations.
I think it would probably be easier to cover the list of things that you haven't done, to be honest. It's quite an extraordinary journey, but what I like about it is when something didn't work for you, you instead advocated to go and do something else, which I think is the mark of a career you can be proud of, and getting real job satisfaction.
Yeah, I think, that's the nice thing about nursing, is you do have that flexibility where, there's many areas that you can work in, and lots of people, you never think about being self-employed as a nurse, but actually there's lots of opportunities. So yeah, I feel very lucky. But thank you.
I mean, so when you went from NHS to private practice, were there any particular challenges and successes that you encountered when you were setting up the clinics?
I think my biggest challenge of going into the private world was having to charge people for treatment, whether it be vaccinations, medication. Having worked in the NHS, where you don't really put a financial cost on anywhere. Obviously, things do cost, but you never actually see the physical pricing of anything. You don't really understand what that means. So going into private, that was quite unusual for me to have to start charging people for treatment, and it's very much you have to take your NHS hat off, and I say that a lot to people that go and move into the private world, is you do have to transition and remove that NHS head and move it into the private world, because it is very different. And I remember the challenges I used to have is it's difficult. People think that you're charging people to make money, so I I found at times I had to kind of justify what I was doing. You know, I'm not doing it to make money. This is guidance. This is national guidance. And sometimes people say to me, you know, are you a real nurse? Or, you know, things like that. And I really struggled with that when I first went into the private world. So I say that was my challenge of transitioning from the NHS to private. The successes I found, well, I originally had to set up a brand new clinic, and I kind of was under the illusion that we'd open the doors and patients would be queuing outside to come in, and unfortunately it didn't work like that. And I, having been an NHS nurse, had never had to do any sort of marketing or anything like that. It was all very new to me. So that was my role for really 6 months, was to do lots of marketing, to have good communication with GP surgeries, because with travel health, the way it really works is some vaccinations are free and some are chargeable. So we had to kind of create that relationship with GPs where they would do the free ones, and then they would recommend us for people to come to us for the chargeable ones. Or if they were fully booked, even for the free ones, people would have to come to us for those as well, and obviously we would have to charge. So I think the success is seeing within that 6-month period, we went from being completely quiet and having hardly any patients to having a fully jam-packed diary, and just that really, really good relationship with GPs, and kind of making a success of the clinic. So yeah, that was really the successes and kind of the struggles. And it took a while to get used to working in the private world, but it was, yeah, definitely a transition.
I mean, just speaking from my own experience, I mean, marketing is, of course, my role. And for someone who's had no experience to go into setting up a clinic and doing the marketing altogether, I'd say that's a success and a journey in and of itself. And I'm sure it couldn't have been easy, but you must have learned a lot along the way.
I definitely did. And it's all, marketing is kind of, you're having to be like an annoying big sister, where you're just, that's how it was for me. So I kind of had a list of all the GP surgeries that I needed to contact, and literally every week, every day, I would choose 5, and then the next week I'd start back at the beginning again. And it's kind of like, me again, just so you know, we're still here if you need us. And it's just that constant marketing, is just that constant. I mean, it's different now because we have social media, but I'm quite old, and when I started, we didn't really have social media. So a lot of it was, sending letters, turning up and having face-to-face meetings. And so yeah, it was all very new to me, but it's, every day's a school day, isn't it? So it was always good to learn new skills.
Absolutely. And marketing for anything has just become an essential. And without the social media aspect, yeah, it is a lot like being an annoying, well, I suppose in my case, an annoying older brother. And I'm sure my younger brothers will tell you that I think marketing was a good fit as a result.
Yeah, it's not easy. It's not easy.
That's just more on school immunization and your role as a school immunization nurse, and the significance of vaccines and vaccination in that context. Just tell us a bit more about that and your role in all of it.
Yeah. So our role is purely to vaccinate school-aged children, and that is anybody from reception all the way up to year 11, and we do vaccinate years 12 to 13 for special needs children as well. So what I always saw with our role is really the main goal of immunisations is that herd protection, that herd immunity. And we're trying to vaccinate as many people as possible. And we know with children, they're really good carriers, especially, airborne viruses. They're not always the cleanest in the world, and they cough and then into their hands, and then they touch something or they touch somebody else. Or so it's very easy for diseases and viruses to spread amongst children. So that's why the purpose is to vaccinate as many children as possible. And we have a variety of vaccinations. Obviously, we have flu, we have tetanus, we have meningitis, we have HPV. So there is heaps of work to do, thousands of children to vaccinate. So that is our role, really, is to first of all organise the sessions, because it is a logistical nightmare when you're dealing with thousands of children, and you're dealing with all age groups. You're going from children who are 4 years old up until anxious teenagers of the age of 14. So some are injections, some are nasal sprays. So it's kind of logistically having to work out how we're going to do it. Secondly is trying to get consent from all of the parents. And again, back in the day when I started, that was all done on paper. So we had to carry folders and folders worth of paper consents. Thankfully now it's now all done online. But the hard bit really is, yes, we need to explain to the children what we're doing, but we're having to kind of get the parents on board, because they're the ones that are having to give consent to their child to be vaccinated. So, and the tricky part is, improving uptake and trying to get as many children vaccinated as possible. So yeah, it's a big task. It really is. I don't think people appreciate the difficulties of being a school immunisation nurse, but it's fun as well. It's definitely you see all sorts of children, and unfortunately sometimes we have to deal with difficult situations, because I always say it's very unusual for a child to get any sort of time on their own with a healthcare professional. When we're seeing children in school, we have, well, sometimes 5 minutes with that child, and actually within that 5 minutes you create relationships. They're having to trust you because you're going to stick a needle in them sometimes too, and sometimes they disclose quite personal information that we have to escalate to safeguarding team if we find that, and that does happen. So yeah, it's a special role. And obviously we have lots of children faint, and we have to deal with that as well, and lots of anxious parents having to answer their questions. So yeah, it's a big role. It's definitely a big role, but it's I was very privileged to have that role for such a long period of time, and I loved it so much. I've now gone back to do some agency work with them. So yeah.
So you've touched on it a couple of times throughout the interview, but is there anything in particular that really inspired you to specialize in vaccination and vaccination training? I mean, how has that become a focal point in your career, besides, of course, doing the immunization work at schools?
Yeah. So I always say most of my career has been around immunising and vaccinating patients. That's really, I call it my baby, my passion. I always say I could talk about vaccinations until the cows come home, because I just feel very passionate about it. And I always say, I say it to children, I say it to adults, we're really lucky. We live in a country where we have access to so many free vaccinations that, potentially save our lives. And we're talking about vaccinations, some were invented many, many years ago, and we're still using those vaccinations because there's always that risk of that disease coming back. So I am very passionate about immunisation. I do feel like we're very lucky. And I always say that I am passionate about sharing my knowledge and my experience and expertise with other healthcare professionals. And what I'm really, my goal, I feel now, is to improve education. And when I teach anybody about immunisations, a lot of what I talk about is education. We need to educate patients more, we need to educate parents more, and from that we need to improve vaccine uptake, and the two kind of come hand in hand. So yeah, I think it's just my long background of immunisations, and now I feel like my purpose is to kind of share that knowledge, share that expertise and that experience, and just kind of share some of my passion and get other people to feel as passionate as me about immunisations. Really, that's my goal.
I think it's a good fight, personally. I've always been a proponent of vaccines and well thought out medical care. I think people who specialize and create these things, they do it for a reason. And then, of course, there's a lot of speculation as to why, and big pharma and all these, various conspiracies. But at the end of the day, the results speak for themselves, and it's good that there are people like you who advocate, and not just advocate, take action, get in there and make sure that the people who need to be taking these things are first educated and then actually are able to take them. And as you said, in the UK, there's a really large prevalence of access to these things, which is, of course, fantastic.
Definitely. And I always say, how can people make choices and informed choices until they're fully informed? And if they're not informed, if they're just Googling it or reading something on social media, well, you're not well informed, so you can't make an informed decision. So I am very passionate about that.
All right, so just jumping along very slightly here, as someone working with both pharmacists and nurses in a limited company, how do you manage to provide support to both professions effectively?
I think it's hard, and I have to have that understanding of what the requirements are for both groups of professionals, because obviously it does differ between the two. And I have to appreciate the different pressures that they both entail. And I know, obviously I understand pressures from a nurse's perspective because I am a nurse, but I really appreciate the pressures of pharmacists as well, and the expectation is always forever growing with pharmacists. Because it's so difficult now to get in to see your GP, the expectation now is people can go to their pharmacist and seek advice from that respect as well. So I do appreciate the different pressures and understand what they need from me. So obviously the expectations from both groups of healthcare professionals is different, and what they need to know from me, because what I tell a nurse may be slightly different to what I need to tell a pharmacist. So it's just having an understanding really of what both the roles entail and what what they need from me and what I can share. And I always say, when I'm teaching nurses or pharmacists, my job is to, when I'm talking about travel health, is to make your lives as easy as possible, to give you as many resources as possible, to make you feel less stressed as much as possible. And that really is my goal when I'm dealing with nurses or pharmacists, really.
Yeah, I mean, I suppose it just takes experience, and I suppose knowing what to give each party, so to keep a level playing field. I mean, throughout your varied nursing journey, you've also had experience working with the NHS and agency roles. And are there any challenges that you faced when managing immunization outbreaks in that particular case?
I know I keep saying the same thing, but it is purely about education. It really, truly is. And I think probably the one that sticks in my head the most was we had a Hep A outbreak. And obviously we know with Hep A, we don't have hepatitis A in the UK. So it's contracted through contaminated food and water. But what we do know is people travel to countries where they are at risk. And if they choose not to be vaccinated or they don't take the right precautions, there's always that risk that it can be something that's brought back to the UK. It's classed as a public health risk. The same with typhoid and the same with cholera. There's always that risk that it can be brought back to the UK. So we did have a school in Essex, which is where I'm from, where they had a hepatitis A outbreak. And it's kind of just educating parents. Obviously, the first thing they're going to feel is anxiety. So it's just explaining to parents, what hepatitis A is, because most people may not know, what the risk is to the child, why we're vaccinating, and what vaccinations we're giving to that child, and obviously the side effects as well. So when you're in an emergency situation where you're trying to roll out a mass program of vaccinations to kind of control an outbreak, you're having to do that very delicately but very quickly at the same time. So it's always about education. It's always about, to me, it's lack of understanding, lack of knowledge, and that is nobody's fault. I have lots of knowledge about immunisations because that's my role and that's my job, but I wouldn't expect kind of the lay public to have that level of knowledge. So it's up to us to share our knowledge and our expertise and listen and understand, and be empathetic, because their anxieties are understandable, but we just need to get those messages across and then obviously vaccinate as quickly as possible.
Absolutely, couldn't agree with you more. Yeah, it can be terrifying. I mean, my mother will tell you herself that when she had to get us vaccinated, unfortunately at the time there were a lot of articles speculating about how certain vaccines might lead to things like autism and of course the merit is shady at best when things like that come out. But as a parent, it's extremely daunting now that you got to give your kids something that you think would maybe affect their future. So
Definitely,
it's, yeah.
Definitely. And I always say to people I'm teaching, don't ever be afraid to share your own experiences. If you felt anxious, I know, talk about COVID. I was anxious to give my child the COVID vaccine because even though I'm very experienced in immunising, for us, COVID was very new, as it was to everybody. So don't ever be afraid to share your own anxieties, your own experiences, because it makes you human, and it makes you feel more like people can approach you and talk to you about their own anxieties as well. But I totally agree. Being a mum myself, I understand those anxieties.
Now, I mean, talking about anxieties and potential worries, I believe in our screening interview, you mentioned a statement about us being on the brink of a measles outbreak and the concern you might have for that. Can you shed some light on that situation and maybe what we can do to prevent it?
Yeah, I mean, it's not great. I have to say, it's not great. We have something called the UK HSA, which is the Health Security Agency, and they have declared a national incident. And that sounds quite scary, and it kind of is quite scary. What it is an agency that kind of highlights the it's like an internal mechanism signalling the growing public health risk, and to really raise awareness and kind of the situation we're in now. And I hate talking about COVID, and I don't want to keep talking about COVID, but this is the impacts that we've got now. So we know that when we have a declined uptake of vaccinations, you're going to see an increase in whatever it is we're trying to vaccinate, whether it's a virus, whether it's a disease, because the two go hand in hand. As soon as the uptake drops, the disease or the virus, the replication of it, the route of infection will grow, and that's just the two go hand in hand. And that's kind of what's happened. And it's really sad because in the UK we actually managed to have a measles free status, so we were free of any measles cases for a whole year. I think it was 2017 2018, so we'd eradicated it in the UK, which is amazing. And we're now at the opposite end of that, where it is now a public health national incident, and it says that we know with measles is super contagious. So when we talk about the rate of infection, we talked about it a lot during COVID, and they said for every one person that had COVID, there's that possibility they can pass it on to 3 people. When we're looking at measles is the most contagious virus that we have. So for every one person that has it, it has the potential of passing it on to 18 other people. So then if you think, if all those 18 people contract measles, then those 18 people will contract measles, and then it goes on. And they've said we are on the verge of an epidemic in London, which isn't great. And it's all because the uptake of the MMR vaccine has dropped. And that's why they've seen a rise in cases. So the World Health Organization target for MMR vaccines is 95%. That's how many people we need to vaccinate to protect the population. And we're just not there. We're not hitting it. And that is all over the world. That's not just in the UK. And I always explain to people, you know, when we're vaccinated, and I said it at the beginning, what we're trying to achieve is this herd protection, this herd immunity. And if you think, if you've got a class of 30 children, for example, and we know children are more at risk because it is a virus that's carried in the air. If you've got a class of 30 children and 18 of those children contract measles, and actually one child in that class has leukemia and is on chemotherapy, so they can't have the MMR vaccine because it's a live vaccine. If they catch measles, then they have quite a high chance that they could die from measles. So when we talk about herd immunity, the way I always explain it is we're trying to vaccinate as many people as possible. And we are an army. So once we're all vaccinated, we're all kind of in this army together. We've all got our arms linked around each other. And in the middle of our big army group are those high risk patients, those patients that either can't be vaccinated because they are on chemotherapy, or they take medication that affects their immune system, or they've had the vaccine but they don't have the best immune system in the world, so they can't create enough antibodies to fight off infection. So our job is to have a big army of people that are vaccinated all together in a circle, and in the middle are those high risk patients that we're trying to protect. And that really is the purpose, the main purpose of immunisation. So that's what's happened. The army has dropped off, and so that means we're exposing more people to measles, and now we have seen the consequences of that, and it is pretty serious, I have to say, because it's so contagious. It is one, apart from whooping cough, it is the most contagious virus that we have. So it's not good. It's not good.
So I think that probably serves as a really good example of just how bad it can get as soon as things are not quite where they should be, as far as advocacy for vaccinations, the essential nature of it. I mean, besides, of course, how you've talked around people obviously not being up to scratch on the measles vaccine. Laura, you spoke about, of course, the bigger picture on why measles vaccination is so essential, and the results or the results of what can happen when things are not kept up to scratch. And so, of course, then advocacy for vaccinations is essential. I mean, can you share some specific instances where you've had to navigate some vaccine refusal, and what strategies did you find to be effective in dealing with those?
Yeah, of course. I think the biggest one that sticks out in my mind was a young girl that we had for a HPV vaccine. Just to give a bit of background behind the HPV vaccine. So we know HPV stands for human papillomavirus, and it is a sexually transmitted virus that we can contract it. It can sit in our bodies, and we don't know we've got it. We don't show any symptoms of it. And then over time, the cells change and turn into cancerous cells. So when we're looking at girls, we know it can cause cervical cancer. So we had, so we give it at the age of about 13, 14. We want to give it to them before they're sexually active. That is the most important thing. And we had a young girl come to us. We did an assembly to talk about the HPV vaccine. She came and spoke to me and said her auntie had actually died, sadly, of cervical cancer. And she was really, really passionate about having her HPV vaccine. When it came to the day of us doing the immunisations, unfortunately, mum had refused for her to have the HPV vaccine, which, you know, baffles my brain anyway, but I have to be non-judgmental. So when I spoke to, obviously I spoke to the call her a child, I guess she is a child, and she was very, very adamant that she wanted to have her HPV vaccine. So we are allowed with vaccinations to do something called GILIC competencies, or work out whether a child is GILIC competent, and we do that if we get a child saying yes but a parent saying no. We are allowed to go through some competencies with that child, and what we're really looking at is does that child have kind of that mental capacity, that mental maturity to understand about vaccinations, and to understand about the side effects of the vaccine that we're giving, to understand what happens if you have the vaccine, what happens if you don't have the vaccine, and from that we can class that child as being what we call GILIC competent. So it means that we can get consent from that child for the vaccine without needing parental consent. Now, I have to stress, we don't do it very often. We do like to have parental consent to give a vaccine, but there are times when, in this situation where, you know, this child's auntie had died from cervical cancer, and that child understood the necessity for needing that HPV vaccine. So really, it's you can get situations like that where you know, parents are saying no and child is saying yes, and it's a difficult journey to go down. But there is always that possibility that we can still vaccinate children, but we do have to stick to those rigorous guidelines. But I think for me, that's probably the biggest one that kind of stands out in my head from memory about a vaccine refusal and kind of how we navigated that.
Okay, so I guess in some dire circumstances, there are some workarounds, or I hate to call it a workaround, but colloquially speaking.
It's like I say, it's very rare. It is rare that we end up in those situations, but it was something that happened many, many years ago. It means there's now some legal guidelines behind it where you can only do it with vaccinations or the contraceptive pill, where we don't always need to get parental consent to a vaccination, but we wouldn't do it very often. It's just those specific cases where we feel the child has a full understanding of why they need the vaccine, and we can navigate that to get to the point of administering a vaccine. And what we always have to remember is all we're trying to do is protect life. So we're not trying to do anything wrong. And I know obviously there are, you know, anti-vaxxers out there, but our role really, we're not trying to do harm. We're just trying to protect life and promote health. And I always say about vaccinations is what we're trying to do is to prevent people from getting the diseases and viruses. We're trying to vaccinate them before they're exposed to these diseases and viruses. So if we think about HPV, for example, what we're trying to do is to protect these children before they're sexually active. And some parents really struggle with that concept.
It is quite a dynamic field and nature, and things are changing all the time. How do you manage to stay updated on the latest developments concerning vaccinations?
Yeah, I mean, there's lots. We have something called the Green Book, which is basically like our Bible with regards to vaccinations. And if there's any amendments or changes, then we have to read the Green Book chapter changes. So that really, firstly, is kind of the guidance that we go to. And the Green Book really is created by a committee called the JCVI, and they are the Joint Committee of Vaccinations and Immunisations. So they meet regularly to discuss anything to do with the world of vaccinations, and they make recommendations about, it could be changing amendments to scheduling of vaccinations, it could be about adding in new vaccinations. They then go to the government to tell them what their recommendations are, and then the government decide whether they want to go ahead with that or not, and 99.9% of the time they do. And then that guidance is put into the Green Book. So that is really the main part of what we work from. So making sure we're reading the Green Book, keeping ourselves updated. You can read the JCVI committee meeting minutes if you want to find out kind of what's happening in the future with regards to immunisations. There's always publications. Obviously, there's always NHS publications. We have something called a vaccine update, which comes to us as an email every month, and talks about any changes, amendments with regards to immunisations. And there's lots of, training. We can do all sorts of training and conferences with regards to vaccination. So, and we do have to update ourselves every year by attending for an immunisation update as well. So, yeah, but it really is up to us throughout that year to kind of keep our ear to the ground and find out whether there is any new changes coming up with regards to immunisations or outbreaks or anything like that.
I mean, it sounds like you guys have got quite a few decent resources to go through. I'm sure it's not so easy sometimes to keep up with it all. But just finally looking ahead, what do you see as the future challenges and also opportunities in this field, and especially in the context of travel medicine in particular?
Yeah, I mean, I think it's very exciting, actually. The world of travel health is forever growing. So we now have just had a new dengue fever vaccine licensed in the UK, which is very exciting. So dengue fever is becoming actually pretty serious. So we know that dengue fever is carried by mosquitoes, and they are day-biting mosquitoes. And the interesting thing about dengue mosquitoes is actually they are in the urban areas, which is unusual. So what they're trying to do is really educate people that live in these areas that is high risk for dengue fever. And we know kind of the long-term implications of dengue. If you can contract dengue once, then you obviously feel quite unwell, but then you should recover quite well from it. The problem with dengue fever is there's 4 different strains of dengue, so you can contract it again, and then if you contract it again, you can end up with dengue hemorrhagic fever, which is then when it becomes quite serious. So very exciting that we now have a vaccine, so we can protect patients before they travel to these endemic regions, which is great. So that is exciting. They are trialling and rolling out a malaria vaccine in some African countries, which is the results that have come from that have been absolutely amazing. So we know how serious malaria is. So that's really exciting, and it's going to save so many lives. We're trying to encourage more people to come in for travel health advice. They found since COVID that actually we know our numbers have increased of people traveling again, which is great, but our numbers have dropped off a bit of people seeking travel health advice before they travel. And the concerning part of that is, a bit like I said earlier, is not only can they contract diseases while they're away, but there's always that risk, obviously, that they can bring certain diseases back with them that then poses a public health risk. So we really want people to get that advice before they travel. And polio eradication is another exciting. So there is something called End Polio now. So there's a big push by the World Health Organization to eradicate polio all over the world. So we've only ever managed to eradicate one disease, which is smallpox. So the next disease that we're trying to eradicate is polio. So lots and lots of work is going in all over the world. Amazing work trying to vaccinate as many people as possible. So yeah, there's lots of exciting things coming up with travel health, and it's forever changing. But really, my my biggest goal is to encourage everybody to seek travel health advice before they travel. And I always say, people go to travel agents and they book these really amazing trips, and nobody ever mentions to them that they might need some travel vaccines or malaria tablets before they travel. So unless they ask somebody, unless they ask a healthcare professional, how are they going to know that they need to protect themselves before they travel? And the whole point of travel health, again, is health promotion, prevention, education. We don't want people's trips to be ruined while they're away. So we need to give that advice, give those vaccines, give those malaria tablets, give those diarrhea treatment kits, give those medical kits, just prevent any eventualities as much as possible. So that is my goal now. And that really is the future for me, is supporting pharmacists to set up their own travel clinics and giving them the tools to run their own travel clinics, and kind of that's my future goal, really.
Oh, Laura Kennedy, thank you for painting such a complete picture. Thank you for all the work you do. And thanks for updating the world of healthcare on the things we need to know and the things we need to keep up on. Even though, of course, you work in the UK, you've got a very complete picture of what's going on in the world, some of those challenges, very I think noble challenges, like things like polio that are completely debilitating. I mean, let's hope, I guess, we can get that eradicated as soon as possible. Yeah, no, it's all very noble cause. And yeah, thank you for sharing all your insights, and thanks for being a passionate, how should I say, just I don't know, a custodian of the industry and really going for it and doing what you do. Thank you very much. And thank you for sharing all your insights on the podcast today.
You're welcome. Some say I'm opinionated. I'm not opinionated. I'm just very passionate. And I'm going to write a song one day called "It's Never Too Late to Vaccinate." That is my goal. Someone's probably going to steal that idea one day, but I want everybody to know, if you miss a vaccine, it's never too late. We've always got that open door policy. We're always going to let people in. We're always going to offer vaccines regardless of, how you feel about them, whether you've just got some questions to ask about them, but we always must offer that open door policy. That is really, really important, and be non-judgmental and empathetic. That's how I feel.
That sounds pretty good to me. Thank you very much again, Laura. If you guys like this content and you like people like Laura Kennedy, who share some really great insights into the world of healthcare, things we need to know, things that are currently happening, going to happen in the future, give us a like. It really helps with the algorithm, and hit subscribe, of course, for more content like this. And we'll see you next time. Cheers, Laura.
Thank you very much.